The incidence of third and fourth degree tears in Australia is about 3%. But in first-time mums alone, it's probably more like 5 or 6%. I think it's imperative for a woman to be aware that there's a chance of having a third or fourth degree tear. I think one of the greatest tragedies would be for a woman to sustain a tear like that and then to turn around and say, I didn't know that could happen to me.
The sort of information I was given about pregnancy and birth, as well as my perineal tearing, was very minimal from my clinician.
Obstetricians and midwives can be a bit concerned about discussing third and fourth degree tears with women, and they're well-meaning. The reason is that they are worried about getting women to worry about something else. However, that's not the best strategy. We know that actually fear of tearing is one of those fears women do have. By talking about it, by talking about how rare it is, by talking about strategies to reduce it, by giving women knowledge and information, we actually help women to become empowered and to become active participants in their care.
If someone had had that conversation with me around tears, I would have felt a lot more empowered and I would have felt a lot more supported, as well as more confident about my birth.
I've found that giving women information about childbirth and talking to them about the risks of third and fourth degree tears doesn't change their desire to have a natural birth. What it does do is give them information which is empowering for them.
During pregnancy, the discussion that we should be having with women around that is this their first baby? Is their baby maybe on a bigger size? Have they had a previous third and fourth degree tear trauma? We would talk to them about things like good diet and exercise, perineal massage, which can reduce the risk for needing, for example, an episiotomy.
The Clinical Care Standards Committee have created an information sheet that can be used as a place to start with. So any health worker could present that information sheet to the woman and read it along with her. And then the woman may have a chance to ask questions about it. It's very important that she understands that you're giving her your time, that you want to give her this information, that you're ready to listen to her, and that you're giving her a chance to talk as well. It's very important to maintain eye contact. It's very important to give written information to the woman so she can take away with her and read that information with her. And I think very importantly, you have to stay calm and try to stay reassuring because it is a stressful subject matter. There are definitely interventions that are taking place in labour which are designed to decrease a woman's third and fourth degree tears. However, I really believe that those interventions should already be known to the woman before labour. They should have already been discussed in the antenatal clinic.
One of the most important things you can do is to try and reduce the need for a forceps or vacuum. That is something we know is strongly associated with severe perineal trauma.
While I was pregnant, it would also, I think, have been useful to have received some information about the importance of the pushing stage in terms of potentially preventing a tear from happening.
This is why it's so important to have these discussions with women before they're in labour, because in labour you don't want to be talking to women excessively. You want women to be able to disappear into what we call labour land. So the only time I'd really be talking to women about their perineal outcomes would be at the point of when the baby's head is starting to emerge, and that's where I'd be saying, now remember we had that conversation, listening to my voice, slowing this bit down. I've got this warm compress on your perineum. I hope that feels comfortable for you. We now need to take this next bit really slowly, listen to my voice, and we'll be able to get through this in the best possible way.
The clinicians identified that I had severe tearing and that I would need to go down to theatre and stitching during my birthing phase. So they were trying to explain to me what would happen and that they would take me down to theatre and stitch me under correct lighting. And during that time, my head was not in that space. I was just really trying to concentrate on pushing my baby out.
I knew I had consented to an episiotomy where the obstetrician performs a cut to assist the use of forceps, and that some stitching would be required, but I didn't immediately know that I had torn as well. I was just in a bubble. My baby was on my chest. I was kissing and cuddling him, and my midwife and my husband were there holding space for me as I attempted to breastfeed, and I am so grateful for that.
A woman has just had her baby. She's so happy, and she's also had a 3rd-degree tear. She doesn't know that yet. I think it's really important that we leave her a bit of time to just savour the moment of the birth of her child.
So when a baby is born, we will inspect the perineum, and at that point we usually identify that there is a bigger tear than just a normal perineal tear during labour and birth. Then a diagnosis is made. It's really important to say to a woman then, look, it looks like you've had a 3rd-degree tear. It's involving some fibres around your anus. We need to now make sure we stitch this really well. The best place to do that is going to be in an operating theatre where we have good lighting and good access to asepsis and the equipment that we need. If you want to keep your baby with you, we're also saying that's really important, that we would try to facilitate that as much as is possible. The repair itself must be done sensitively. There must be good anaesthetic. The person doing the repair must always check in and say, please tell me if you're uncomfortable, please tell me if you're feeling this. You shouldn't be feeling pain, you'll feel pressure. And I find that when I have that really good information being passed on to women, they just sort of sit back and they cuddle their baby and pretty much forget what's happening at the other end.
It's very important for members of the team who were involved with the birth of the baby visit the mother the next day. So she has the opportunity to ask questions about the birth and the events that led to the injury, so that you have a chance to answer them and help her with her own queries and concerns.
There was one midwife at the hospital who was really down to earth and sort of just talked to me straight and said that it doesn't happen to many women, but when it does, it's really rubbish, and it's totally normal that I'm struggling, because all women do when this happens to them, and that it won't be like this forever, that I'll recover. And just having someone say that to me gave me permission to feel how I was feeling, I guess.
So for women going home, it's really important they're given an appointment to a follow-up visit. What are some of the things you need to look out for? If these symptoms occur, then please contact us. And they're things like, leaking stools, not being able to control your wind, leaking urine, or painful intercourse. There's so much that can be done, and many women just put up with it, or in fact, they just stop their sex lives, which can have a huge impact on a partnership as well.
Postnatal depression is a common problem without a woman having to have a 3rd or 4th degree tear at the same time. And it's important that she knows that there are psychological services available for her, and giving her access to those.
What is really clear is we need to be respectful as health providers. We need to make sure women are fully informed, that they give consent for everything we do. The most important thing for clinicians is, yes, of course, to be clinically expert. But women tell us that what's important is that their clinicians are also kind, compassionate, and respectful. It's not enough to just be clinically competent. We also need to be absolutely mindful that women are observing, listening, and absorbing everything we do and we say, and all the expressions on our face. So it's a package deal.